Good evening, everyone, school committee members, parents, students, staff. I'm not a resident of Smithfield. I'm a physician and I work out of the Tri-County Health Centers where I'm the chief medical officer. Within our treatment area is Smithfield. So many of my patients actually are students here. Many parents here see me as a primary care provider as well. I'm also an assistant clinical professor at the Brown Medical School. I'm an expert in LGBTQ health in particular. And I'm a communications consultant for about a dozen local schools within Rhode Island, hospitals, and healthcare settings. I was informed of the new transgender policy with concern around informing parents of a student's identity, primarily around their gender. And so obviously it grabbed my attention and I wanted to make sure I came here today to just speak a few words that could hopefully be enlightening or helpful. I've never once been to one of these school committee meetings before. And I must say that they are incredibly thoughtful and inspiring, and I've really enjoyed it already just in the last hour. I'm a family medicine doctor by training, and so I take care of entire families. I deliver babies, I take care of children, adults, and older adults as well. Many of my patients are LGBTQ identifying. It's actually one of the primary reasons people will seek me out for primary care. And in Rhode Island, we don't have many primary care providers who offer that care, or are comfortable talking to individuals about their sexual orientation or about their gender identity, which means that I have people from all over the state and in Massachusetts and Connecticut who come to find me, sometimes traveling a couple of hours. Some of your staff here have actually invited me here. I recognized when I drove up here that I've actually given a presentation here on gender identity and sexual orientation for, I believe it was the middle school population, which was just lovely, because there aren't too many school districts that would put that forward. I'm here to mostly express the concern around this discussion about outing students to their parents when it comes to their gender identity. I want to express why that's a concern for me. As a physician, I have access to very intimate conversations and information with patients. Children themselves, their families, their support systems, and those involved in all of that care. And the conversations we have are really intimate and really personal, and I think it would be helpful for you to hear some of that. I've cared for children here in Rhode Island who've been kicked out of their homes because of how they identify. In fact, 40% of our homeless youth in Rhode Island identify as LGBTQ, despite making up only 7% of the population in Rhode Island. I've cared for children who've been harassed, beaten, verbally and emotionally tormented by those closest to them, all because of how they identify. 9 out of 10 LGBTQ youth have experienced harassment or discrimination just within the past year. Those who experience discrimination and harassment are much more likely to miss school and or drop out compared to those who do not. More than 1 in 3 LGBTQ youth reported that they had been physically threatened or harmed due to their identity within the last year. I've also cared for children whose families and identities have unfortunately left them to feel quite alone in the world. In a world in which we do not honor their privacy and their rights the same way we honor those of others, or in the majority. 92% of LGBTQ youth stated that they hear negative messages about what it means to be LGBTQ. And worst of all, that in my 7 years practicing as a primary care physician in Rhode Island, I've cared for children who unfortunately decided that it was better to end their lives than to continue living. 40% of LGBTQ youth make that same decision to end their lives, compared to just 12% of the general population. All of this to say that our identities are deeply, deeply personal. They need to be honored and they need to be respected. These statistics demonstrate the severity of discrimination and harassment that LGBTQ youth face in schools, in their homes, in their communities, in their daily lives. They also highlight the urgent need for creating safe and affirming environments for LGBTQ students, that of which I know this school district is capable of and has proven they've done in the past. As a physician expert in the field, I would be remiss to not emphasize the importance of creating safe spaces for LGBTQ students and the dangers of outing these students to their parents without their consent. It is important to note that outing a student to their parents can put the student in danger and cause serious harm. It's crucial to provide privacy and confidentiality for our LGBTQ students. This means ensuring that students' gender identities and sexual orientations are kept confidential and that they are not forced to disclose this information unless they choose to do so. If a student is outed without consent, it can put them at risk of physical, emotional, and psychological harm, including rejection, abuse, and even homelessness. Thank you for allowing me to come tonight and share a few of these thoughts. It means a great deal to me, and I hope it will be helpful in putting together whatever your final recommendations are for your school district policy. Together we can do better, and we can all do better when we feel we're safe and supported. Thank you.
Thank you.